I hope no one here has ever been admitted to a trauma centre, but should you visit one, you may notice patients exhibiting the same symptoms: elevated temperature, heart rate, breathing rate. These symptoms may not all be from the same condition though. The body's response to a traumatic injury is the same as that from an infection. And to make matters worse, traumatic injuries can often become infected. And so how can we distinguish between the two? Well, we can collect blood samples and see if bacteria grow, but this can take days, which is just far too long. And so more typically, doctors will prescribe antibiotics just in case. Now this can be bad for three reasons. One, antibiotics will destroy a patient's good bacteria, which will decrease the rate of recovery for these patients. Two, it's an unnecessary expense for the healthcare system. And three, it increases the rate of antibiotic resistance. You may have heard about this in the news, where bacteria mutate to become immune to the antibiotics we have, and this affects everyone, not just trauma patients. And so this is where my work comes in. I've been given a data set from the hospital which contains information about the substances in patients' blood. So if we look at the graph in part 2, we can clearly see, the blue circles are data from patients without infection, and the red circles are patients with infection. We can clearly see that an increase in the concentration of substance 1 diagnoses this infection. Sadly, this is just for illustrative purposes, and the data is not as nice as that. Also, I have upwards of 40 substances, and so to visualize this, I'd need 40 axes, and so 40 dimensions, and so I just can't do this. I write computer algorithms which process the raw data, and they tell me which substances are of significance. So what can I do with these? Well, the overall aim is to create a diagnostic sensor, and so we want to detect these substances, and so we look to the body. You may be familiar with enzymes, so they aid with things such as digestion. So in your stomach, there are specific enzymes which will bind to specific food molecules to break them down. So the red enzyme here has a specific binding site for the blue substance. We can create a specific binding site on a gold chip. So we can position green molecules, dot them around, and when you join up the dots, you can see that the blue substance fits specifically. And when it does fit, you'll see we can get it to emit light, and that's now a sensor. And so the overall aim of my project is to identify these substances which can diagnose infection, and then to create a sensor which can be taken to the hospital and used at the bedside. And this will reduce antibiotic resistance, save money, and hopefully save lives. Thank you.